Hi there. There are various reasons why an injury struggles to heal and causes pain weeks, months, or even after years after the initial onset. So in this video, I'm going to go over 4 reasons why an injury may struggle to heal and also provide solutions. So after watching this video, you may have a better understanding how to heal your injuries properly. And just to be clear, I'm going to talk about orthopedic and sports injuries. For bed sores or non-healing wounds that struggle to close, I've posted about a video about Chinese herbs that stop bleeding and also aid tissue repair. So for bed sores and non-healing wounds that are struggling to close, I suggest watching that video separately. The big picture is in Chinese medicine, we believe that if we want an injury heal, if we want an injury to properly heal, we need plenty of blood flow and we need plenty of good circulation. So anything that decreases circulation will also delay the healing. So for someone is a smoker or someone suffering from diabetes, they most likely will have difficulty healing of their injuries. Solution for this is very simple. Cut out smoking and fix metabolic health. And I know this is easier said than done, but I also do believe that with time, effort, and dedication, anything is possible. Reason number 2 is ice. Ice is also a big one in Western medicine. It's very common to see that someone ices their injury weeks and even after months after the initial onset. And ice is used as a poultice to control pain, to control swelling, and control heat. And cooling therapies are justified and beneficial in the first stage of healing when there's a lot of pain, there's a lot of swelling, there's a lot of heat present, there's a lot of discomfort. However, in Chinese medicine, even during the first stage, we don't use ice because we believe that ice just delays the healing. In Chinese medicine, we have better alternatives available to control the pain, to control the swelling, to control the heat, to control the discomfort without the unwanted side effects of icing. Ice, we believe, just constricts and causes stagnation, therefore limits blood flow, therefore delays the healing. So it's also very common to see people icing their injuries weeks, months, sometimes even years after the injury. And then these are the very same people who complain about having the injury difficulty healing and also more pain, especially when it's cold and raining outside. As heat, swelling, discomfort, and pain decreases, in Chinese medicine, we switch to more neutral or more warming herbs to restore circulation, to restore blood flow, and also to aid healing. For those who over-iced their injuries and struggle with healing, have more pain when it's cold and raining outside, in the clinic, we use 3 products: Tendon lotion and Collateral liniment. They're both alcohol-based. And the third one is an oil-based UI oil. The herbs in these products are very warming, so they're not recommended during the first stage of healing. Using them during the first stage would just aggravate the injury, would cause more pain, more swelling, and more discomfort. However, in the second and third stage, this is what we use, and this is what we use for people who have their injury, over-ice their injury, and also struggle with healing. The way to use it is to apply it to the affected area, really rub it into the tissue, and then for like 5 minutes, and then apply a hot pack or hydrocollator over it for like 10 minutes and allow the heat and allow the herbs to penetrate deep into the tissue, restore the loss of circulation, and with that, allow the body to heal the injury. And in the clinic, what we usually do is 3 times a week for 4 weeks. That's plenty of time to see if the injury heals. Reason number 3 is similar, different, but similar, is diet. Specifically, overconsumption of cold, cooling foods, ice drinks, ice cream, but also overconsuming salads, raw fruits, raw vegetables, following the raw food diet. This is just in general, can also be causing symptoms for someone with a weaker constitution. For those people who are weaker, can suffer from overconsuming raw fruits, raw vegetables. The raw food diet can cause abdominal pain, bloating, diarrhea. In females, can also cause difficulty getting pregnant and painful periods. But for those recovering from an injury, can delay the healing. The stomach enzymes work best at 37 Celsius, which is about 96 to 97 Fahrenheit, if I'm correct. Anything below that, the body needs to warm up the foods in order to be able to break it down. That is energy that could be used for healing of the injury. So while someone recovering from an injury, we suggest in general to consume simple foods, simple warming wet dishes, soups, stews, and warming teas. Also, Meridian Kitchen has this bone and tendon healing soup, which is a bunch of herbs that can be added to soups, stews, and bone broths, and to aid healing of a bone or tendon injury. It's actually tastes really good. And then reason number 4 is the amount of active versus passive therapy someone involves in uses during recovery. Passive therapies such as medications, interventions, surgery, but also manual therapy, massage, and acupuncture are very beneficial and crucial during the initial stage of healing. However, in my experience with working with in rehab, people who are involved in active care, breath work, visualization, meditation, mobility work, stretching, strengthening, specifically strengthening, so therefore exercise, those who are involved in active care usually recover faster and usually recover better than those who just involved in and engaged in passive care. Usually the rule of thumb that I go by is as pain and swelling decreases, I involve the patients in more active form of therapy, starting with breath work, then later introducing mobility work, and then lastly, strengthening. So these were the 4 reasons. Big picture is we need blood flow. We need good circulation. Anything that decreases blood flow delays the healing. So smoking, diabetes, ice, consuming cold and raw fruits can all delay the healing. And also the amount of active versus passive therapy someone is involved in. Hopefully this was useful, and thank you.